So today we're going to talk about the second part of the Sompayrac text, and this is the last day we're going to talk about it. Next week we'll do Jeopardy, and if you're watching online, I'll just post the Jeopardy game up on the website, so you can play on your own, but I'm not going to record us playing. And it would just be review questions for what we've talked about already. And then we'll jump into Janeway. Okay, so I have 3 pre-test questions today. Name the components of the T-cell receptor complex. You can just think of it to yourself or write them down if you want. Name the components of a T-cell co-stimulator. And name 2 down-regulating cytokines. Okay. So at the end of last week, we were starting to get into cell-mediated immunity. So if you remember, the first big branch of the immune system, we kind of talk about the adaptive and the innate. And then in the adaptive, we talk about humoral and cell-mediated. And cell-mediated is pretty much the T-cell stuff. So we're continuing on with that today. So T-cells, of course, the way we tell a T-cell, in fact, on flow cytometry, right, is that the cell has a T-cell receptor. The T-cell receptor is made up of both an alpha molecule and a beta molecule, or 95% of our T-cells are made up in this way. These all also have something called a co-receptor. It's either CD4 or CD8. So a co-receptor, if you recall, is another molecule that actually binds to the same thing as the receptor does. The T-cell receptor, of course, would recognize and bind to the MHC protein complex. So CD4 or CD8 is a co-receptor because they also bind to MHC. All T-cells, we know from caring for children with the George, are educated in the thymus in order to be a T-cell. Pre-T-cell till it's been to the thymus. So if you don't have a thymus, your T-cell counts are absent or very low if you have very little thymus. And then there's a second broad category of T-cells called gamma delta T-cells that don't have co-receptors. They do undergo rearrangement, but the result is much less diverse. They're found anywhere where you're likely to have pathogen entry into the body. So around the intestine, the uterus, tongue. And they are capable of something, they recognize MIC-A, MIC-B, which is expressed on stressed cells. And there's something called NK T cells, which are about 1% of circulating T cells. They also mature in the thymus and have alpha-beta receptors. And they recognize lipids presented on the non-classical MHC, which we've talked about once before. You may remember that non-classical MHC is called. Very good, CD1. Okay, so in and of itself, the T-cell receptor cannot act. The alpha and beta chains are both extracellular, and they really can't signal towards the nucleus. So it's always found in a complex, and the rest of the complex is made up of CD3, and that CD3 is responsible for the signaling. So CD3 is made up of a gamma chain, a delta chain, and 2 epsilon chains, and 2 zeta chains. Now the zeta chains sometimes are included in the CD3 complex and sometimes aren't, depending on which text you're reading. So it may say the T-cell receptor complex is the alpha-beta chains of the T-cell receptor and CD3, or it may say that T-cell receptor complex is made of alpha-beta chains, CD3, and 2 zeta chains. So just be aware, it's just a bit of a nomenclature difference. So it's capable of signaling for activation, energy, or death through this process. And then, of course, these alpha-beta T cells have the co-receptor. So I put a picture here to just help understand a little bit. So you have your T cell receptor, which is made of an alpha-beta chain, and then you have the surrounding CD3 complex, that is important for signaling towards the nucleus. And then there's also a co-receptor that, remember, it's a co-receptor because it binds to the same thing the receptor does, so the MHC in this case. It's important in adhesion, adhering these two cells together temporarily so the signaling can occur, and it actually amplifies the signal towards the nucleus. Of course, the CD4 co-receptor binds to MHC class 2, and CD8 co-receptor binds to MHC class 1. And then there's something called co-stimulators, which, as the name would imply, are important in co-stimulation. It actually amplifies the T cell receptor signal. Anyone have an example of a co-stimulator? Yeah. CD28 and exactly CD28 and B7. CD28 on the T cell does not bind to the same thing as the receptor does. It has its own molecule that it binds to. In this case, it's B7 or CD80, CD86. This signal is actually required for activation of naive T cells. So that can't happen with just the T cell receptor. It has to have this co-stimulation at the same time. And this kind of first introduces the idea of immunologic synapse. So you'll get into trouble if you really think of cells in a two-dimensional way with just two receptors interacting. But in reality, what happens are these receptors float around on lipid rafts, around the cell. And as two cells move close to each other, they all come into what we call an immunologic synapse, very close together. So there's lots of different interactions happening in a three-dimensional way. So if you think of on each cell almost a whole circle of different receptors that are interacting, that's the reality of what's happening when two cells interact. In immunology, we try and break things down and make it more simple by describing one interaction at a time. But it's really a very quick, dynamic, complex process that's occurring. So we'll talk more about immunologic synapse as the year goes on, but just to kind of introduce the topic and to make sure you're trying to visualize these things in a way that will make sense when you're trying to understand them. Okay, so this is just a picture to include the CD28, the co-stimulator, right? So we have MHC in it, the antigen, and then of course we have antigen, and then we have the alpha-beta chain of the T cell receptor, and then the rest of the T cell receptor complex for signaling. And of course we have a co-stimulator that is going to help with both adhesion and signaling. And then we have a CD28, this co-stimulator B7 interaction that is also going to help with signaling and is in fact required in naive T cells. So all these things are going to be happening at the same time with other things as well. And what's the point of all this? So the signal happens, and then what a CD4 T cells are going to do is that once they're stimulated, they're going to make cytokines that are appropriate for this particular battle, for this immunologic battle. So typically, we think of CD4 T cells as secreting a set of cytokines. CD4 cells, depending on what antigen is presented and depending on what signals it receives from that dendritic cell in that initial interaction, kind of becomes a subset, and that subset will secrete its set of cytokines. So the first two we knew about, and probably when you were all in med school, I know when I was in med school, all we talked about was Th1 and Th2 cells. So Th1 CD4 cells we know as cells that secrete these cytokines, IL-2, interferon gamma, IL-12, interferon gamma probably being the quintessential one. And then Th2 is a subset of CD4 that secretes IL-4, IL-5, and IL-13. And now, as we've learned more, we know there's lots of other subsets as well. So Tregs is one that's gotten a lot of attention in recent years that secrete these down-regulating cytokines like TGF-beta and IL-10, which tend to calm the immune system down, not upregulate it like Th1 and Th2 tends to do. Then there's one that we're realizing is important in autoimmunity, Th17, that secretes IL-17. There's many more that I don't have listed here, like Th33, and every year we're kind of renaming some subsets. But don't let them upset you. It's really just a way to subset them to understand which cytokines that it is decided to secrete. As simple as that. So don't get too hung up on the cytokines at this point, but start to maybe get a feel for what the different ones do. IL-2 is one of the first cytokines secreted, and it's very important because it stimulates growth, differentiation, and survival of T cells. Interferon gamma primes macrophages to engulf more bacteria. I talked about that before, but it also has a signal for B cells to switch to secreting IgG3. IL-12 is secreted by macrophages, and it causes T cells to switch that Th1, so then it's a positive feedback loop that it's going, the macrophage is then going to secrete more interferon. IL-4 is a growth factor for B cells, and it causes them to switch to IgE. IL-5 tells B cells to switch to IgA and stimulates eosinophil. The monoclonal IL-5, there's lots of monoclonals now, but one for hypereosinophilic syndrome is an anti-IL-5. And then IL-10 and TGF-beta, like I mentioned before, are typically down-regulating cytokines. Okay, so I talked about this quickly, but how does a T cell know how to subset? Well, it's largely dependent on what the dendritic cell decides to do at the beginning of the battle. So remember, the dendritic cell, like the macrophage, is kind of a sentinel, and it sits in the periphery, and it waits for bacteria to get through the skin or wherever, and it's going to engulf it, and it's going to receive signals via pattern recognition receptors, which we'll talk about in a couple weeks. The pattern is on the bacteria. The receptor on the dendritic cell, those pattern recognition receptors help that cell decide what to do. So the dendritic cell, of course, then presents on MHC to the T cell to get the T cell, the naive T cell, revved up. And it's also going to send signals, cytokine signals, to the T cell to tell it what to subset to. So the T cell knows what cytokines will be effective in this particular battle to clear the infection. And then, of course, the T cell moves to the appropriate location and secretes cytokines to locally influence the battle. CD8 cells, on the other hand, are similar to NK cells, that they actually work by killing cells. So they can do this in two ways, but they can deliver something called perforin and granzyme to kill a cell, or it can actually initiate a signal via the apoptosis receptor, the fast ligand interaction. So using either of these two methods, again, we'll learn more about these as time goes on. CD8 cells will kill a cell that is either infected or stressed, or a tumor cell. Okay, moving right along, we're going to talk a little bit more about the lymphoid organs. So lymphoid organs are typically divided into primary lymphoid organs and secondary lymphoid organs. The primary lymphoid organs actually make the B and T cells. Anybody know what those are? Yes, bone marrow and thymus, very good. So B cells, of course, are produced in the bone marrow. T cells are produced in the thymus. If you have no T cells. And then there are secondary lymphoid organs, which are all the lymph nodes, the spleen, and a lot of other lymph node-like tissue, like MALT, mucosal-associated lymphoid tissue. that's specialized at sites of infection, sites of different organs. So lymphoid follicles are something that are found in all secondary lymphoid organs. There's both primary and secondary, and lymphoid follicles are where B cells are. So the primary lymphoid organs have something called follicular dendritic cells, which, in my opinion, are poorly named because they aren't related to the other dendritic cells that we've talked about. But they sit and they make a web pattern inside these primary lymphoid organs. And I kind of mentioned before, let's see if I can get this back up. Oh, maybe. All right. There we go. All right. So remember we talked about, okay, here's the site of infection, right? Say you've got a hand. And you've got your dendritic cells and your macrophages that are the sentinels just waiting. And they hop back into the lymph to go to a lymph node. And the T cells waiting to get activated by the dendritic cell, right? If the T cell doesn't get activated, the B cell can't get activated because that's what's going to happen next. And the B cells are here in their follicles. But there's lots of them. And this B cell, although it's not going to get activated, needs to know that it needs to travel to the outside of its follicle to interact with the T cell, which is coming to the outside as well. So if this is stuck in the middle, the T cell will never be able to directly interact with it. So for that to happen, not only is the dendritic cell traveling through the lymph here, well, little bits and pieces of, say, the bacteria that got into the skin is going to be traveling through the lymph, and it's going to get caught in this web of the follicular dendritic cells, and then it's going to present to the B cell, and it's not going to stimulate the B cell, but it's going to get it, it's going to cause it to change just enough to travel to the outside of the follicle where it has a chance of meeting up with the T cell. So it's not any B cell that can respond to a bacteria. It's got to be that B cell that recognizes it that's appropriate. So it's really a very limited amount of B's and T's. So to increase the likelihood that all of this dendritic cell can find the appropriate T cells can find the appropriate B cell, there's a set of signals going on to get everything to move to the right place. I'll talk more about that later as well, but just to get an idea. Yeah. No. Okay. Okay. So there are two entrances into a lymph node for the bacteria and relevant cells to get into them. So one is through the lymph, where it travels from the marginal sinus into the cortex, where the B cell zone is, to the paracortex, where the T cell zone is, and the medullary sinus, and I'll show you a picture in a minute. But the artery or arterioles are also an entrance. So cells, like T cells, we know are in the blood, right? Because if we draw a CBC, we can see that they're there. But these lymphocytes actually need to get into the lymph nodes. So they can go through these specialized cells called high endothelial venules and escape, because they're kind of holy, and get into the lymph node. but they cannot get back into the blood that direction. They actually have to complete the circuit, and the only way out for cells is through the lymph. So blood can go in and come back out in the veins, venules and the veins, but all the cells have to leave in the lymph and then eventually go into the thoracic duct and get put back into circulation. Okay, so here's a picture I pulled down just to kind of demonstrate this. So so the arteries, you can get these high endothelial venules, and cells can pop up and then go to their relevant places, so the T cell zones or the B cell zones, these follicles. Or you have these dendritic cells and bits of bacteria coming in through the lymph. These are the two ways in. The only way out, though, for blood is through the vein, and the only way out for all these cells is through the lymph. Okay. And then there are lymph node-like things, the MALT, mucosal-associated lymphoid tissue, and in one type of this we call Peyer's patches that is found in the intestine. So it also includes these high endothelial venules and outgoing lymph, but it does not have incoming lymph. Instead, antigens are engulfed in these endosomes in a specialized type of cell. Anybody remember what this cell is called? The letters?
Oh, M.
M cells, very good. So here's just a picture to kind of demonstrate this. So here's an M cell. So if this is the lumen of your GI tract, if you need something sampled, a piece of bacteria, it's going to be pulled in through the M cell. But it's organized very similarly, otherwise it acts very similarly in that it's organizing T cells and B cells into zones and will then help make, in this case, probably IgA if it's needed to sweep away a pathogenic bacteria. Okay, so the spleen is another example of secondary lymphoid tissue. It is located between an artery and vein, and in general it filters our blood. It has no incoming lymphatics. It has a marginal sinus that contains macrophages that actually clean the blood. And then the T cells are organized into an area called the PALS. I think it's the arteriolar lymphoid sheath or something like that. Anyway, not important right now. B cells are located between the marginal sinus and the PALS. So again, lymphoid organs are just organizing the cells into relevant places to do their job. The spleen is a little bit different than the others in that it's more than sampling and kind of starting the immune system, but it really plays a very important part in cleaning the blood. Although that being said, you can live, of course, a very healthy life without the spleen. Okay, so I think this is actually the last thing that's covered in this part of the Sompayrac text. And it introduces the idea of lymphocyte trafficking. So I think I mentioned earlier that, right, so there's something called chemokines that are cytokines. The chemokines are cytokines that tell cells where to go. So lymphocytes respond to chemokine signals, but they can also respond to specialized selectins. So we talked about this a little bit before. Selectins and integrins are a way to adhere a cell to a place where you want it to slow down and stop and be able to squeeze out of the blood vessel. And there's some specialized interactions, some that you'll see repeated over and over. And there's lists and lists and lists and lists of these. And I think it's very hard to decide which ones to memorize for the board. But my recommendation is that anyone that that stands out, and some of them are just so similar in name, but any that stands out, use those because they're going to stand out to a person who's writing a question as well. So a couple examples are L-selectin, which binds to glycam-1, is important in the high endothelial venules of lymph nodes to get these cells out. And then there's one called alpha-4 beta-7, which binds to MAdCAM-1, which is important for the high endothelial venules of Peyer's patches in the gut. Oh, never mind, we do have, okay, one more concept. Down regulation. So the immune system can't go uncontrolled forever. So it's very, we learn a lot about how it gets revved up, but now we're in this day and age very, very curious to how we can calm it down, because our immune systems sometimes get revved up, and it's happening at a very high rate with autoimmunity and allergic disease. So in recent years, we know more about this. We know there is something called CTLA-4 that competes with CD28 for B7. So when this starts to get expressed, that's a signal that the battle's been won by the immune system, and it's time to start down-regulating it. And it actually will suppress activation as opposed to CD28, which, of course, stimulates activation. And then, of course, there's certain T cells that will secrete these down-regulatory cytokines, which I mentioned before. Does anybody remember what they are?
IL-10, TGF.
Yeah, very good. IL-10 and TGF-beta. So there's two types of regulatory T cells that we know of right now: inducible T regulatory cells and central T regulatory cells. The inducible ones can actually be induced from T helper cells that have already been activated, but then they can change and resubset and then start to secrete when the signals it's receiving are confirmatory that, okay, well, the bacteria is being cleared, it's time to stop. Cytokines will start, and CTLA-4 will come out, and everything will start slowing down and be signaled to stop. Okay. Pre-test questions. Name the components of the T-cell receptor complex.
CD3. Alpha, beta.
Very good. Yep, T-cell receptor, which is alpha beta, and then CD3, gamma delta 2 epsilon, and then the zeta chains, parts of CD3 and not. Name the components of a T-cell co-stimulator.
28.
Yep, exactly. CD28, B7. B7 is also known as CD80 or CD86. Don't overwhelm yourself. Just start to get comfortable with the fact there's going to be lots of names for all these things, and you need to know them all. And two down-regulating cytokines, done to death, IL-10 and TGF-beta. All right, any questions about all that? So next week, just a review. We'll play Jeopardy, review, and then get into Janeway, and it's going to be much harder, but don't get overwhelmed.